Joining us now, president of the Center for Health and Democracy and former health insurance executive Wendell Potter. He's also the author of Deadly Spin and senior national correspondent for HuffPost and author of The 10-Year War, Obamacare and the Unfinished Crusade for Universal Coverage, Jonathan Cohn. Gentlemen, thank you. Jonathan, were you surprised how quickly this turned from what in the world happened to Brian Thompson to a large contingent of Americans coming out and saying he deserved it?
Yeah, I mean, I wasn't surprised. I mean, look, let's be clear. I mean, you don't want to be celebrating somebody's murder. You know, it doesn't justify it in any way. But anybody who's sort of observed the American healthcare system knows there's a lot of people very angry with the healthcare system, a lot of people who can't pay for their healthcare, they can't get the treatment they need. And a big reason why is that for a lot of people, especially people with serious medical issues, they have to go through prior authorizations. They have to figure out with their insurance company which doctors they need, which they don't. And when they try to get treatment, they run into these obstacles. The treatments get denied. They can try to appeal it. It takes a long time. Sometimes, for some people, it's just a nuisance. For a lot of people, it's a really serious problem. It means they don't get the care they need. They have to pay these enormous bills out of pocket. It's incredibly frustrating, and in the worst case, it's bad for their health. People are sick, they're suffering, you know, maybe even dying because of this.
Yeah. You know, everybody has a story about dealing with insurance companies, and not many of those stories, Wendell, are happy stories. The perception is that these companies are not in it to care for people. It's not for the service. It's to squeeze as much money as they possibly can out of individuals. And when push comes to shove, when those individuals need that money back, to delay in order for the person to give up or to get more money out of them. Is that an incorrect perception of how the industry works?
No, it's not at all. It is the correct perception, it's the reality. And it's notable that this murder, this corporate assassination, took place in Manhattan on the day that United Health was holding its Investor Day. This assailant had to know that that was significant, because the reason why we have these delays, why we have this challenge that so many people with health insurance have in getting the care that they need, is because of the slavish devotion of these companies to Wall Street. They have to meet Wall Street's profit expectations every 3 months, and to show them that they are managing expenses. And that means there's greater and greater use of prior authorization, higher out-of-pocket costs before their coverage kicks in, inadequate provider networks. Delays and denials are what people encounter these days increasingly if they have health insurance. And I think it's been just below the surface. I knew when I was in the industry, people despise these companies. They hate dealing with them because they're difficult to deal with. And often they get a no. And it's so hard to figure out what to do when you get that no.
Is this the kind of thing, Wendell, that it's inspiring a conversation out there? I mean, it's got to be eye-opening for the insurance companies. Is it eye-opening for the insurance companies? Would they be surprised at this sort of reaction?
They're not going to be surprised, but this will change them in ways that I think we've never seen anything before do that. They've operated with impunity, and they felt that this rage could always be contained, and that they've spent so much money on propaganda. I used to lead a propaganda shop on campaign donations, on lobbying expenses, on events like Investor Day to persuade Wall Street we've got this covered. There's a day of reckoning that is happening right now, and I think this has triggered that. This has given people an opportunity or a reason to vent on social media like I've never seen before. It's going to change the way they do business in certain ways. They're going to become more insular. But even back then, I wouldn't tell people what I did for a living. You can be certain these folks are not going to do that either.
Jonathan, do you think this might inspire a change?
I mean, it's hard to know. I mean, we've actually been having versions of this fight for decades, and Wendell knows this as well as anybody. You know, this fight came up in the 1990s. It came up in the fight when there was the fight about the Affordable Care Act. You know, all of this is taking the context of a much broader political fight over how much power to give private insurance companies, the for-profit industry, over how we how we give out health care in this country. And when we get to the point of a political debate, of course, these companies will weigh in on that political debate. They have a lot of power. And what, I think has happened in the past, at least I've observed, is there tends to be a reaction right away. There tends to be a sort of promises of change. But then over time, we see the behavior slip back to what it was.
The politics of this I find really interesting because the number of people that I've heard from regarding this and what I've been able to just see online, it is a broad swath of Americans, people who come from all walks of life, excuse me, including a lot of doctors who have just a lot of hate for the healthcare industry and how they personally experience it and what they witness either in emergency rooms or just from their daily care, what they can get covered, what they can't get covered. The stress and the sometimes trauma of having to deal with the insurance companies separate from having to try to care from the patients. The politics of it, because there is so much anger. You're talking about maybe just trying to change it for a moment and then hoping that people forget. This doesn't seem like it's something that's so easy to forget because of the daily interactions, Jonathan, that people have with healthcare industry, with insurance companies. Right now, there's somebody, probably thousands of people on the phone with their insurance company arguing about coverage.
Yeah, I mean, look, this is something anybody who's had to deal with any kind of serious medical problem almost certainly has had to deal with firsthand. I mean, there's a real unhappiness out there. It creates a real anger. The hard part is when you actually get to doing something about it, and then it gets to become a complicated political fight. And that's really when these companies are able, and not just the insurance companies, by the way, it's all the players in the healthcare system, are able to sort of throw up resistance and make it harder to actually build a consensus towards some kinds of change. And that's why it's been so difficult over the years to improve this system, which doesn't mean it can't happen, but it does mean that people need to sort of channel that energy into some kind of political movement, I think, something sort of constructive, where they say, look, we want to change, and this is what we want change to look like.
Yeah, I wonder, because this is, again, a really interesting moment. There is so much distrust of institutions, of industry. It's part of the reason why Donald Trump got elected, and he's able to put the various people he's trying to put into these cabinet positions because people don't believe government works. They don't like corporations. There is this seething anger, and they thought that Donald Trump was the person to best fight it. I mean, you can argue whether that is actually accurate, that Donald Trump will deliver on that, but there is an expectation that he's going to. And given that, Wendell, do you see this as an inflection point, as different leverage on the industry, a pressure on the industry than there might have been in the past?
I do. In fact, when this happened, I was in Washington actually meeting with Republican members of Congress to see where there is common ground with Democrats on moving forward with reform. And there really is. It's the first time I've ever seen this kind of bipartisan interest in reform. Now, it's not going to be easy, to Jonathan's point, because these companies spend enormous amounts of money to influence how politicians think and how they vote. But I'm seeing a change. And to the point earlier that you made, Katie, about doctors being really fed up with health insurance companies, they are as well, too. They are having a hard time advocating for their patients, getting paid as they need to be. They're dealing with prior authorization requirements more than they ever have before. Their patients are having to face high out-of-pocket costs before their coverage kicks in. They, too, are fed up. And so are employers. I talk to employers a lot. I do a lot of speeches to employer groups, to agents and brokers. On the private sector, there is enormous pressure now to change. And these companies are in the crosshairs. Sad to say, it's probably a bad expression, but they are targeted by a lot of people in the United States, whether we're talking about employers, patients, doctors. Just about everybody despises health insurance companies in ways that I've never seen before.